Okay, let's continue.
Assalamu alaikum, everyone. So we're here today to talk about a very important topic. If you can just give us 1 minute for us to get everything shared on different groups, and then we will start our program, inshallah.
Make sure you put it in.
Okay, so assalamu alaikum, everyone. So today we're here to talk about a really, really important topic. And honestly, I think this is the time when we need to really not only discuss it, but we have to come up with ways how we're going to help this situation, how we're going to provide help, provide education, provide awareness on mental illness. So mental illness is a situation, it's so different than physical illness or medical illness or whatever you want to call it. With medical illness, we can easily look at something, diagnose what the issue is, see if it's working, is the treatment working, change the treatment. But with mental illness, it's totally different, right? And a lot of people are not even aware that mental illness exists. And some of them who are aware wants to just push it under the rug. They are in denial, and it's just very difficult right now for them to even accept there's such a thing called mental illness. So one of the part of mental illness, and there are many aspects of mental illness, but the one that keeps knocking on everyone's door is depression. And depression is so widespread right now. I am going to go out on a limb and say almost 1 out of every 2 homes probably has someone who's facing depression or knows someone who is depressed, right? So today, what we want to do, we really want to not sugarcoat anything today. We want to really talk about depression and how it's affecting our community, how it's affecting families, how individuals, our kids, everyone is being affected by depression. So one thing I always see is that depression has to be blamed on someone. And the one thing that I see all the time is, oh, they're depressed because they have bad friends. America did this to us, okay? It's always something. It's never addressing that it is an illness. It's always everything but being an illness. So today, honestly, I don't want to waste any time because there's so much to discuss. I want to introduce you first to our panel. So Dr. Hamdan is a psychologist. I think everybody knows her by now. An-Nisa is our counselor. She's our, just a lot of different things wrapped up in one. She's a social worker. She's a counselor, mashallah. And I think everyone knows her too. And Dr. Atika Zaki, who is one of our psychiatrists at An-Nisa. She's been with us for years. Amazing work, mashallah. So today we want to address depression, okay? We want to really go into the core of depression today, not just, oh, depression is an illness. We know that already. So I'm going to start with Dr. Hamdan, inshallah. She has a presentation. We'll talk about what is depression, all the parts of depression. So go ahead, Dr. Hamdan. I think Dr. Hamdan is muted. Is your...
Okay, is that better?
Okay.
Okay. Could you hear anything I said or no?
No.
Okay, let's start this again then. Okay. Salam alaikum, everyone. Thank you for having me. Like I said, this is a very important topic with the recent event. I want to just go around in order for us to kind of really start tackling this and breaking the stigma. We need to understand what we're actually trying to tackle. What is depression? In a nutshell, a lot of times when people are sad, I've heard this firsthand from my own family growing up, in a conservative Muslim family and Middle Eastern family. My mom would always be like, oh, if you're sad, the first thing she says is like, oh, God's not happy with you. Or, go pray 2 rak'ah and ask for forgiveness. And it was always a spiritual remedy. But depression is a real medical problem. And we actually need to stop telling people, it's all in your head, go pray and ask for guidance, be grateful for what you have, just get over it. I mean, I've heard these things firsthand from people who mean well, but they don't realize what they're saying is actually quite harmful. When you suffer depression, what people think you feel is actually sadness. But what you're actually feeling is a variety of things, from sometimes just nothing. But a lot of also like hopelessness or guilt or even anxiety for feeling that way. And this is what I'm saying about, clarifying the misconception that it's not about just being sad. So it's very important to separate the two. They're very different things, and people think that they're one and of the same. And this is kind of getting into Bibi, your question about like clinical depression versus just depression. And people interpret it as being more like, okay, you're sad. To make it, very clear, I kind of just did a breakdown in terms of what is depression versus sadness. If you actually look over here, on one hand, depression, it is a condition of mental disturbance. And, depending on the type of depression, it's like a minimum of 2 weeks of ongoing symptoms. It lasts longer. It can be treated with therapy and medication, in addition to other things, which I'll go through. And it's a mental disorder. Sadness, on the other hand, it's a feeling. It's a normal feeling that all humans are born with, but you actually get over it. It doesn't just linger beyond the day. And it's not something that requires professional help. And it's an actual emotional feeling. It's quite normal. So it's very important just to separate the two. So you could think of one that lasts a lot longer and also starts interrupt. Depression is more about, it lasts longer and it also starts interrupting your day. And sometimes actually, I know people who smile all day and they're quite depressed. So it's very important to kind of, make sure that it's not, we're just looking for sadness. It's a lot more than sadness. Now, the other thing that people don't realize, there's actually 6 different types of depression. One that that I'll maybe be talking about today predominantly is about major depressive disorder, which is the #1 mental illness around the world. And, one of the main things with major depressive disorder is that it is, the symptoms are present for a minimum of 2 weeks. And then obviously there's things like psychotic depression, and then there's other things where you can be depressed and you can have anxiety. But for simple terms, I want to just talk about like this first one here, which is major depressive disorder. Because with the symptoms for these, and these are the clinical diagnosis of the symptoms, is that there's emotional symptoms, physical symptoms, and behavioral symptoms. And it's the combination of these symptoms that you have for over 2+ weeks that could be clinically diagnosed for someone who's actually depressed. We'll also be sharing this, so you guys can kind of refer back to these. I don't want to kind of just, read from the screen. But it's important to recognize it's not just the emotional symptoms or the physical symptoms. It's also it's a combination of emotional, physical, and behavioral symptoms. Now, the one thing is that in cognitive theory, that the belief is that there's 3 beliefs that people who are depressed have. And one of them is that I'm inadequate or I'm not good enough. That's a common belief that cognitive behavioral therapy, Aaron Beck, who's like the godfather of therapy, has found in all his research is that these 3 dominant beliefs are in people who are depressed. I'm inadequate, which is basically I'm not enough. All my efforts are basically I'm a failure. And the third one is that either my future is hopeless or I'm hopeless. And the sense of hope is quite critical. And if someone has these, so part of therapy is actually working with someone to actually reframe these negative beliefs, because if this is their worldview, it's very difficult to get someone out of this. Now, for treatment, many believe it's only religion or medication and therapy. And what I actually want to open your eyes to, it's not only this. What treatment actually looks like is actually a plethora of multiple things. And one thing is, yes, therapy helps, medication helps, religion helps, but it can't happen in isolation. We need to make sure that we're actually doing multiple things continuously to get help. And I've seen with my clients and even with myself is that when I'm doing different things and continuously, whether I'm exercising and eating healthy, and I'm like traveling and I'm doing things and I'm looking for the future, it's difficult because you have that sense of hope. Whereas if you're not doing these different things, you're stuck in that almost paralyzed sense of like, I'm a failure and I'm not doing anything in my life. So, I gave a very fast kind of spiel because I want to give the other great speakers an opportunity, but I really just want to give you an overview of what the difference is between, depression and sadness, and also kind of debunking the myth about treatment is only religion, or that treatment is just therapy and medication. It's therapy, medication, religion, and plus, plus, plus. Okay. Because we need to start educating people that their well-being is not just dependent on others. They can actually do things themselves and start taking control of their own healing. All right. So let's work together to break this stigma. I'm going to pass this on over to the next speaker.
Okay, so Anna's up next, and Anna, a lot of things that we've been seeing, especially at An-Nisa, a lot of young, like kids, children, youth are coming in for, a lot of them are for depression, right? So can you just give a little bit idea of what actually in children and youth, what does depression look like? Is it the same like what Dr. Hamdan was saying, or is there some different things that we should be looking for?
Assalamu alaikum, everyone. Yes, Bibi, I see a lot of the children that come into An-Nisa and the youth, and what Dr. Hamdan was saying, most of that is true with kids as well, but there's also different things that we have to be looking for in children and youth because they experience things differently than adults do. So it's natural for kids and children, just like adults, to experience emotional ups and downs. But for some children, feeling blue for an extended period of time can be a sign of depression. Like, you see your child just feeling down in the dumps, always, moping around. And if that's happening for an extended period of time, just like Dr. Hamdan was saying, more than 2 weeks, a minimum of 2 weeks, then yes, that is a sign as well. We might think of it as growing pains. A lot of times we chalk this up as, oh, our child is just going through growing pains, and that is the reason why they're experiencing this. But a lot of times depression and anxiety for children go hand in hand. Anxiety is basically the medical condition that causes feelings of fear, panic, worry about everyday situations. And that's what a lot of times parents do, and not just parents, but adults, school teachers. We think that children are teenagers and they're just growing up, and this is the stuff that they're going through, but them being blue for an extended period of time is something that you have to worry about. So what causes, depression, anxiety in children? There's so many things going on with our youth right now. There's alcohol or drug use, your environment with your family problems, trauma, a family history of depression, genetics, biological reasons, physical illnesses, stressful life situations. All of these contribute to things in children. And the thing is, the difference between children and adults, the major difference is that they often have a very difficult time explaining how they're feeling, especially if they're experiencing depression, because they don't know how to communicate the way an adult would. So I just want to give you some key signs and symptoms to look out for, especially if they're happening over several weeks and they're out of character for your child. So children with depression may have very low energy and have difficulty being motivated. They're losing interest in activities that they used to love doing, such as maybe they loved riding their bike, or they loved hanging out with their friends, or they loved playing board games. If they're losing those interests, that's something to look out for. Having difficulty listening and concentrating on tasks, that's something that's very different in children as well. Sometimes when you give them instructions and they're having difficulty concentrating on that one task, that can be a sign. Making negative comments about themselves constantly, that's a cry for help. When a child is saying, oh, I wish I looked beautiful, or I don't look good, or just constant negative comments about themselves, that's something you need to look out for. Withdrawing from social situations, not wanting to spend time with friends, looking for what's wrong with than seeing the positives, always looking at the negative. And they're very difficult to please. They're easily agitated and annoyed and upset, and they're crying easily, and they have no interest in food. They're having trouble sleeping. These are all signs in a child or a youth. And
So,
they
no, 1 second. I wanted to ask you before you change. I don't want you to lose that thought. But
Okay.
if the kids are feeling like that? What helps them to cope with those feelings?
So I loved what Dr. Hamdan showed us on that slide. There's so many different things, right? So with children, we can't just say, okay, well, why aren't you happy? Or you go make dua, or, these are the things that a lot of times parents and adults say to children as well. But as parents, what we can do to control, we can't control the stressors in our children's lives, but we can help improve their mental health by ensuring that they get daily exercise, providing a supportive and safe home and a safe environment, not calling them names, not constantly putting them down, getting them plenty of sleep, giving them well-balanced meals. I know that we push our kids to do this, but being there for them, sometimes just being present in that moment with your child and sitting there. Also encouraging your children to not, a lot of times we have to teach our children that there's so many people that are going through, we have to talk about depression and anxiety and mental illnesses with our children so they can be kinder individuals. Because there are people in the school, there's children in schools being bullied. And if we teach our children to be kinder, we don't know what that other child is going through. Like Dr. Hamdan was saying, some of the most depressed people are always smiling. Some of the most depressed children are always smiling. So we have to start with our own children, while we're bringing them up, teach them to be kinder, because bullying contributes to depression at a great level. And we as a society, we as parents have to start teaching our children to be kinder individuals. We don't know what anybody's going through. So be that one that reaches out to those children. Be that friend. If you see somebody sitting alone, just sit there. You don't have to be best friends with them, but just we have to mold our children to be better human beings. Be that one that reaches out to a friend.
Okay, so I still have a lot of questions for both you and Dr. Hamdan, but I wanted to just jump over to Dr. Zaki for a minute, because now we know what depression looks like, how people behave with depression. But Dr. Zaki, how do we actually treat depression?
Assalamu alaikum. So a lot of things have been said for depression, but I want to make one thing clear. The diagnosis of depression is very, very important. It can be, because the treatment is different. For the medications are totally different. If somebody has bipolar depression, if they are giving the medication of unipolar depression, like the only depression, it can make it worse. So diagnosis is very critical. Stigma, if the parents or the patients, they are willing to see a primary care doctor and can get help from them, but they are not specialists in that. However, my video is not on. Oh, sorry. Can you see me now? Sorry about that. So, people, the stigma of going to see a shrink is really hard for them. The word shrink, they are really scared. I don't know, they can talk very easily to a primary care doctor, but when they come to see a psychiatrist, they are really scared. And the stigma, who will see, who will find out, is a big thing. So once you recognize the symptoms of depression, the shame and guilt of getting treatment is over, then we start the treatment. So as Dr. Hamdan said, treatment is biopsychosocial. So bio means the medication, psycho means the psychological therapies, and socially, that all she said other thing like putting their kids into karate classes or make them busy. That is very important. And one thing I want to add for children depression is that they get angry because they cannot express, so they get angry. So very common symptom, they're fighting in school, they're fighting at home, they're irritable, they're agitated, and they can be agitated for a number of things. So you have to get a very clear history to get a diagnosis before you start the treatment. So the first line treatment, like medications. The issue with medication is that first of all, they're very scared to take the medications. And even you take the name of the medication that you need to take these medications, the first question they will ask, when can we stop the medication? And they not even have started the medication. So that's an issue. They have to come with open mind. It's just like any physical illness. If they have diabetes or blood pressure, they take medications and it's getting treated. Same things like depression, bipolar, schizophrenia, any mental illness, it needs medicine. And medication and psychotherapy, if they go hand in hand, the effect is enhanced. So I would highly recommend patients to do combination of the treatment. So there are a lot of classes of antidepressants. We are talking specifically about antidepressant, and every class works. The studies have shown there is improvement. Their suppression of symptoms is more than 50%, and if it's combined with the therapies, it get more. So antidepressant, the main thing is that people are scared that it gives side effects. The side effects are not as bad. If they start with a low dose and they go slow, they take away all the side effects. There's a lot of propaganda that all antidepressant makes people suicidal. There's a black box warning. Yes, there is a black box warning about it, but if it's given in a proper way, like a very low dose, start low and go slow, then usually in the initial anxiety and those kind of symptoms go away and kids don't become suicidal. So you need to observe it very carefully. Then besides medication and psychotherapy, there's another form of treatment is called ECT, electric convulsive therapy. We call it shock therapy. It's very, the propaganda is really inhuman, and all movies show that it's really, they're giving in a bad way. Lot of studies have been done, and it's a very, very effective treatment. It has 90% remission of the symptoms. And the side effects, if it's given in a proper way with a lot of oxygenation and ventilation and a lot of other things being considered, the side effects are not as bad as it has been, it has been talked about. Then there is another modality is called TMS, it's magnetic stimulation, transcranial magnetic. This is also, it's not like ECT, it's not as effective, but it is effective, and it's not as invasive as electric convulsive therapy. So a lot of people who have side effect from medication or who don't want to take medication, this can be a good alternative for that.
So Dr. Zaki, what is how important is it the follow-up visits? Because I know some people think they got medicine, they're good, they don't need to. How important is it for them to follow up, and how important is it for them to inform their doctor of what symptoms and how they're feeling, all of that?
The most important thing is the close relationship with the doctor and therapist. Patient has to be honest. If patient is not telling that what are the problems they're having and what side effects are they having, or are they improving and not improving, doctor cannot do anything different. I don't know in the case, this sad case that happened, how much they were talking, because there are a lot of medication. If one medicine doesn't work, you can try a different medication, but you have to try and find out the good fix for you. Like if somebody has headache, somebody take Tylenol, somebody take ibuprofen, both work. But it depends upon which one will suit your body. So the follow-up treatment is very important. And there is for the medication, there is a thing, is there's acute treatment, the continuation of the treatment, and maintenance of the treatment. So the first 1 to 12 weeks is the acute treatment, when we are trying to control the symptoms. Then when they get to the baseline, their symptoms go away. That is the key thing. From there, the continuation of the treatment goes, and that usually lasts for 4 to 6 to 9 months. And this is the critical time when people stop the medicine and they relapse and the depression come back, and they try to harm themselves something.
Yeah. Okay, so one important thing, I know we've talked about stigma, But I wanted to ask, actually, I'll go to Dr. Hamdan first. What are some of the stigma that are related to mental illness, and what are some of the myths? Like, it's so ridiculous that we don't, we're stuck in that, but it doesn't help us in any way.
I mean, one of the main things is that, therapy is for crazy people. I mean, that's one of the biggest myths, is that until you're like really crazy, but there's myth is that if you're a successful, educated person that's experiencing, depression, that you should have all the tools. And the reality is, it's just, look, if happiness was in a bottle, the number one prescription isn't antidepressants. Everyone would be happy. And, one thing that I see with all my clients is that there are high functioning individuals that on the outside looking in, you think they've got everything together. But this is where I'm saying your internal cognitive beliefs about yourself play a critical role. So you need to be your own judge. If you are having a lot of negative thoughts, that's a good window, independent of like the stigma of like, oh, it's only for crazy people. Once you go to a therapist, you'll realize it's actually you kind of get addicted, because you're like, oh, I have someone who's actually listening to me and really, wants to hear me out. So the main thing I would say is just, don't knock it till you try it. It's not for crazy people. I think everybody should go to a therapist. I really believe that what therapists do is we educate you about yourself. I mean, who doesn't want to learn about themselves? And, I do believe in the combination of therapy and medication. In certain cases, and I've seen dramatic effects of it. So it really works. And I've also seen what's happened when people don't take their medication, or they don't come to therapy. And I also see them kind of, they're progressing, and then they all of a sudden start regressing because they're good for 2-3 months. They think, okay, I got this. And then they don't continue. They don't follow up with medication, or they don't follow up with therapy. And then all of a sudden, 6 months later, they're back, they're worse than what they were. So, the main thing is that we have to just normalize it and look at therapy more as an education of, let's learn more about ourselves, and, what's the harm in that?
Okay, so I want to ask this question to Amna and to Dr. Zaki, because it's two different, counseling and treatment. So what are the difficulties you face trying to help, first of all, children who are depressed? I know a lot of parents want to be in denial and all of that. What are the difficulties, first, Amna, that you see when you try to treat kids and adults? And then we'll go to Dr. Zaki with the same question.
So what Dr. Zaki was saying, I want to go back on, kind of reiterate what she was saying, the stigma of not the medications, of the, that's one of the things that I have with the youth. The first question they ask is, am I going to get addicted? Am I going to have to take this forever? Am I going to be able to get off of this medication? And inshallah, most cases you will be able to, but there will be some cases where it's okay. You might have to take medication lifelong. You might have to be in therapy lifelong, but those are the more extreme cases. But it is okay, just as if somebody with diabetes or somebody has hypertension that has to take medication for a very long time. But that's the number one thing that I hear with my youth and with the parents that bring their youth. They're like, well, we don't want our kids to get addicted. We don't want our kids to have to be on this forever. And that stigma, we have to break it. And I'm so glad that Dr. Zaki and Dr. Hamdan have mentioned this, because medication, the side effects of the medication are just side effects, but you not living, you're not going to be alive. There's many people, I'm going to be very honest, I'm going to be very candid. It's either you might be dead or you might have side effects to the medication. So that I'm going to be very honest with parents. And I know as a therapist, I get frustrated sometimes too, but I'm constantly like, if I have clients that are on medication, the first thing I ask when they come to my session is, how are you taking your medicine? Are you taking your dose properly? I have clients that change up their doses because they think they can on their own.
Yeah.
And their parents think they can without the doctor's consent. And that can actually mess up your brain and mess up the biological functioning much worse. Like, it can make it really bad. So you have to go therapy, like what she said, biopsychosocial, everything contributes. It's all together.
Right. Dr. Zaki, what are the difficulties you see in treating patients with depression? What are the things, the struggles that you go through?
Compliance. First of all, they are willing to take the medicine. This is the biggest thing. They really are scared of medicine because social media and everything, and the propaganda is so negative against the medication that they are so scared to take the medication. And in reality, they don't have those kind of bad side effects. And if you have side effect, that can be addressed. The medicine can be changed or can be lowered, or a lot of things can be done. So first, like yesterday, I saw a patient, a child, an adolescent was crying for help. He was saying that he feel like killing himself. He wants to kill himself, and he is extremely depressed. But dad said no. Dad said maybe it's a mistake, and he meant to say that he had some socialization, but he doesn't want to. So both parties, if it's a child and a parent, both parties have to agree to take the medication. Then the compliance is the main thing. Close follow-ups is the main thing. The length of the treatment is main thing. And one thing I want to tell, that the quality of life is so important. It's good to enjoy life rather than be sad and negative and dark and gloomy all the time. If the quality of life is better, the chance of they're happy and their functioning gets better, and there's less trauma and less aggression at home. Recently, because of depression, anxiety, and agitation, so many murders are happening beside this thing. I'm hearing every day somebody died, and because of those frustrations that can be prevented, treatable.
Yeah, I agree. Amna, you wanted to add something?
Yeah, I wanted to add on to what she was just saying. I want to say this to the community. One of the reasons why a lot of parents, a lot of children don't come to therapy, don't come to seek out medication, is because what the community, they're scared of what people are going to say. What is going to happen if somebody finds out that my child is in therapy, or my child has clinical depression, my child is suffering from a mental health illness? That I want to talk to you directly, to us, to me. We have to stop that. We have to be able to say, my child is depressed. My child is autistic. My child is dyslexic. My child has anxiety. And we should be okay with it. Just as if we were to go and tell somebody, my child has cancer. My child is diabetic. We should be able to talk about it normally and not say, oh my God, what did you do? Or what, I want the community to understand, because a lot of times the brunt of the pain on the parents' shoulders and the children's shoulders, because what is my community going to say about me?
Yeah. Go ahead, Dr. Zaki.
So one thing I would say, family has to accept first. Then, parent or the wife or husband, if they accept each other and they accept that there is a problem, things will be solved.
Then and only then. Yeah, I agree. Another thing is, a lot of people think that if we take medication, our kids are not going to get into good schools, our kids can never become doctors, lawyers. There's so many myths that go on with this. And, if instead of them thinking this, they need to come out and ask, right? So, Dr. Hamdan, I know this is the toughest question. I always keep it for you, but in light of the situation that happened with the murder-suicide family that just occurred, the boy was on medication. He, in his note, he stated so many things about this depression, and I think he was trying to bring awareness of depression in his note. What do you think about what do you think could have helped him? Like, what do you think that he might have been missing that could have helped this situation, if there was anything? Or is this, and I think I would like to ask Dr. Zaki too after this.
Well, one of the things, and I was actually this relates back to your previous question, is that the one thing that I realized when I read the letter and that scenario is that who was his board of advisors, or who was he going and seeking advice from? And it sounds like there was different confidants, but the true confidant the only one was his brother. So if you're going to a person who has just as much experience, if not more, and that's your person who doesn't have more, and that's the person that's actually giving you the advice, that's concerning, because you should be going to experts or people that know this to actually seek the advice. But decisions are being made based on a very small sphere of influence. And that's quite dangerous. And then one thing I've realized, I don't care what, if you're 30, 40, or 15 or 16, if the people around you are not encouraging you and supporting you in your I don't know, treatment or in getting help, you won't continue. There's a direct correlation, and they've shown many studies that your sphere of influence, that the 5 closest people around you, if they do not encourage you, then you will not continue with whatever, you won't seek help. And then if you do seek help, you won't continue, because usually what will happen is people will start shaming it. Oh, they start mocking it. So I think for him, I really believe that, I don't know enough detail, but from the letter and just the little that I do know, it didn't seem like there was a solid soundproof social system other than his parents and his family that he was really getting the right guidance and support from.
That's such a good point, because I think that you may have a counselor, you may have a psychiatrist that you're going to, but if the environment around you is just going to remain the way it is, then you are not going to get help from that.
Can I just add one more thing too?
Yes.
Is that it's, and I was a part of when I was in New York, and this was a while ago. Okay. So when Prozac had the monopoly on the market, okay, Zoloft wanted to come out and they wanted to penetrate the market with Zoloft. So they actually went and did studies, and they actually said, okay, what can we do to get people to take antidepressants? And one of the things that they found in the research in the focus groups is that the language that people talked about when they had depression, they actually would go out and say, I am depressed. And so the identity was very, very strong. So it was a part of them. Whereas if someone has a broken arm, what do they say? They say, I have a broken arm. The I have it's external to them. It's something that they could fix. When someone's depressed, they say, I am depressed. So they think of it as an identity thing that they can't change. It's fixed. So that's, this is going back to, we have to change our language around these things so we can realize that it's something, it's not who we are. It's something that's treatable.
Yeah,
So,
I agree. 100%. That's Dr. Zaki, one important question I have to ask you. So we have illness. So why is it that they separated, this bothers me a lot. Why is it that they separated mental illness from just illness, right? I know we can't see it and we can't address it, but they made it to look like something separate from you not feeling well. Why is there a reason why that happened? Do you know?
I think because in physical illness, you have blood tests, you have x-rays, you have everything. So it's very objective and everybody can see it. But in mental illness, it's just observation and what they are saying. So they cannot put like as a mental illness, like an illness, because nobody can prove it. One thing also I want to add to that case that Dr. Hamdan said, she pointed out very good, but I also want to address, he was trying to get help from the friends, from this group, from that group. There is no therapist involved. They have to have a good relationship with a therapist. A good therapy can make it or break it, So, and also some people go to a therapist and they don't feel connected. Change. If they don't like psychiatrists, change. Find the psychiatrist and therapist that you feel comfortable opening up.
Yeah, good point. Another question that's from the, I guess out from our Facebook, parents who have kids with depression, what do they do if the kids do not want to go to school? They don't want to study. I know we have had lots of clients that didn't want to come out of their room. I had a client that for 3 months, she didn't come out of her room. What do family members around, what do they do to help that situation?
If the functioning is that bad, that she is like stuck in a room and hopeless and helpless and her functioning is affected, get little higher form of treatment. She doesn't have to be inpatient, maybe a day program where she can get therapy 3 days, 5 days a week for 3 hours. It's a jump start. Therapy 1 hour per week doesn't work as fast. If they do like a day program and start the treatment, once the depression gets better, their motivation gets better. Medication cannot take away your problem, but medication helps you to cope better for the stressors.
A lot of people don't know that there are different programs. They think it's meds and that's it, and that's the,
No.
there.
So there is, if they are acutely suicidal, they need to be hospitalized.
Yeah.
And people freak out. Safety comes first. They have to be hospitalized for the safety. It doesn't matter, because your kid has to be, or your family member has to be alive to do other things. But if they're acutely suicidal, they have a plan, please put them in inpatient.
Yeah.
It's not bad. And then if they are not that, but they have suicidal ideation, but they don't have a plan, and family can observe, then they can do day program. In day program, they can stay at home, but they get therapy 5 days a week.
Excellent. That's such good advice. So Dr. Hamdan, one question from the audience is, does sadness and depression ever overlap each other?
Absolutely. In fact, a lot of times, sometimes it starts off as sadness, and then as it prolongs, this goes back into the over 2 weeks, something happens, and then it continues ongoing. That's why the time frame is quite critical, because then it's no longer sadness because it's not resolving itself, and it's continuing. And that's where it could start off as sadness, and if it doesn't resolve itself and continues, that's when it becomes depression.
Wow. Okay, so that's something to really, I think we need to do another one of these programs, a little more in depth of these things, because honestly, I think this is when people learn what it is exactly, they only know the basic, right? We need to teach them the core of everything. And the last question before we leave, Amna, how can we destigmatize seeing a psychiatrist or a shrink, as Dr. Zaki said?
Well, the first thing we have to talk about it in our homes. Like it's normal, because even talking as a husband and wife talking about it, I've heard clients and parents, and even in families, I've seen people say, don't use the word suicide. What if our child picks that word up and they go try to commit suicide? I've heard this from so many people. We have to start talking about it in our homes with our 5-year-old child, not about suicide, but age appropriate. What is sadness? We have to talk about emotions. We have to talk about these things, because if we don't, our kids are going to learn things. They're not going to have that support system. They're going to go to the wrong people. Like Dr. Hamdan was saying, he was going to his brother, right? If we don't talk about it in our homes, we're not going to be able to destigmatize it. We have to talk about it like it's absolutely normal. These feelings are normal. Being sad, being happy. These are things that you can talk about with your 4-year-old. When you age appropriate, you go up, you talk about, like I spoke to my children about this incident, my 15-year-old son. It's very important, because they're seeing everything. And if we as parents aren't talking to our children about these things, they're going to be learning from other places. And we have to talk about it with our friends, in our communities. I go to gatherings with my friends, and I know some people don't like talking about this. They get really uncomfortable. Oh, I want to be happy. I don't want to talk about these things.
Yeah.
But we have to.
I agree. Anybody else have anything to add to that? Because we're about to close up the program for Maghrib. Okay. All right. So inshallah, we plan to have a few of these programs. We have other counselors and psychiatrists at An-Nisa who we're going to bring on to address different aspects of mental illnesses. But I really, really want us to stop hiding, okay? This is not the time where we just cover up and say, oh my gosh, it's gonna get better, or, blame people. This is not the time to do that. How many people do we know that have committed suicide in our community? Our children, adults, anybody, it can happen to anybody. And really, we have to try our best to educate, to bring awareness, and to preventing is so important right now. Helping, treating, and there's so much to do. So inshallah, I think we will go ahead and close the program. But inshallah, we will be addressing this a lot more, inshallah. Okay, and to all the counselors in this community, to all the mental health professionals, you guys are so amazing, because like we all said, you cannot do an x-ray, you cannot do an MRI, you can't do any of these things. You have to work and work hard to help just one person. So you guys are really the frontliners, the soldiers of helping people with depression, anxiety, any mental health. So I have the highest respect for every single one of you in our community. So Jazakallah khair, everyone. Inshallah, We'll see you soon. And any questions, please feel free to email us or put it on our Facebook, inshallah. Okay. Assalamu alaikum, everyone. Thank you, everyone. Dr. Hamdan, Amna, Dr. Zaki, amazing program, mashallah. Thank you for so much information and education. Assalamu alaikum, everyone.
Assalamu alaikum.